We've seen that on television, smile makeovers. You know, it was fascinating that invariably the most impressive aspect to the facial beauty makeovers was the dental side of it. And there was some, I'm told there was some tug back and forth between the plastic surgeons and the dentists about getting the proper respect or acknowledgement of what was really bringing about those changes. But one level is just having the beauty in their smile, but the unspoken part of it is how getting their facial balance correct also changes the way their body postures on their spine, how you can make somebody look better from a teeth point of view and they're still miserable in terms of their ears. They can have ringing, buzzing, hissing when their lower jaw is back. So if somebody comes in with a class 2 retruded mandible, which is a good 60–70% of the problems that people have in our population, and you just straighten their teeth out, you've left an enormous musculoskeletal burden on their body, on their neck and shoulders. Nearly irresponsible in my mind. So when we see the Asian population or the people of color, they have great noses, so they have huge LeBron James smiles, but they have great airway. So we don't see those kinds of problems, and restoring people when they have good noses and good arches is a completely different kind of challenge than we've got the narrow face kinds of problems. So I feel there's a deep responsibility to be mindful of that stuff and to be a good guy dentist, because it's scary, it's overwhelming, it's expensive, it takes time. You need to have a rapport and enjoy who you're dealing with. And we've got work to do if your facial balance is out of whack. So facial makeovers is kind of a superficial term for let's fix some things, but more often than not, there's a fair amount of things that are going on behind the scenes that's part of our responsibility to deal with that also.